It's Friday, the 21st. My name is Chad, this is Nick. We're from Proform Physical Therapy in Salisbury, Massachusetts. It is 1 o'clock Eastern Standard Time, so I don't know what time it is where all you guys are, but just to give you guys a little background of what we are, we're a physical therapy or a physiotherapy clinic in the state of Massachusetts. And we have a unique hybrid approach to how we do things here. So we do physical therapy, but we also do performance training. And part of that, we work a lot with feet. So by working with the feet, we find that we can really, hone in on the functional aspect there. So we'll just give you a little tour really quick. So this is kind of our facility in a nutshell. We're upstairs. This is our little turf area. And then down here, we have our gym setup. So you can see it's not your normal average physical therapy clinic that you would typically see. So this is how we're going about trying to change that game with physical therapy as well as with performance training, kind of commingling everything together because it all does work together. So how we're going to do it today is we're going to talk about footwear fiction. You saw our little video about Dr. Seuss. We're not going to be reading any Dr. Seuss books, but what we will be doing is we'll be talking about footwear history first. After we talk about the history of footwear, we're actually going to go over today's footwear, what's involved there, footwear anatomy and such. We're going to talk about what's happening inside your shoe. All right, we've actually got a nice example of a shoe that we're going to cut up for you, and we've got a nice model here that can show you what's going on in there while it's happening. We're going to talk about the chain reactions that kind of happen up the body as a result of that shoe. And then we're going to talk about a little bit of our approach to how we transition somebody from, say, a max supportive shoe to a more natural footwear shoe like the Vivobarefoots. Okay, so without further ado, I'm going to give it to Nick. Nick's going to talk about footwear history.
All right, so to provide clarity to really any topic, it's always good to go back and look at the history. So when we look at shoes and footwear, we have some archaeological evidence and data that shows us humans have been making footwear for roughly around 40,000 years. Probably longer than that, but that's what we know. And then if we go about 25 to 30,000, we start to see changes in the skeletons and the archaeological evidence in the bony structure, and then there's also evidence to show that there was some weakness of muscles of the foot and toes because of these structural changes. Now when we think about that concept, a 10,000 year progression, right, the foot has probably changed even more since then, and now we're probably living through another change where we're seeing more bunions, we're seeing more structural anomalies in the foot. They're becoming more and more frequent year by year, and that's probably another adaptation that could be occurring with footwear as a big underlying factor. So when footwear was first made, it was really made in response to the environment. It was made to protect us from environmental factors, such as the cold. And if we shift gears to today, it's kind of different. We're making footwear for aesthetic purposes, for performance advantages, and then what we think is helping with injury prevention. But I'll get to that in a minute. It's kind of a murky area there. But when we think about the foot and the footwear being for protection, we can use an example like back in Dutch colonies where it was very marshy, the areas. Clogs were invented, and we see clogs in hospitals all the time, and clogs were made wooden so people could get through that marshy terrain without ruining their shoes or causing their feet to kind of, prune up. So we think about clogs nowadays, it's got synthetic cushion and all this stuff that we just, if I'm gonna stand all day, I wanna stand on some cushion. So that's really more of a preference and a desire by the human. So we created a shoe back then that was to protect us from the environment, and now we're creating it to protect us from ourselves, really, right? So in a society where we move less, we move less variably, we're sitting more, we're in one position pretty regularly, so we're creating this shoe to fit our needs and desire, or our wants and desires, not so much to protect us from environmental factors. Now along with that, the shoe is also, going back to that clog example, allowed us to interact with the environment. And nowadays, it's not so much the case. We're getting into that kind of murky area as I described. Another aspect of history in footwear is that there was always kind of some representation of society and class with regard to the footwear. So if you think about back in like ancient Egypt, the color of your sandals represented what class you were in, or even like Victorian England, you had the size of your sole told what class you were in. So, you know, kings and queens were basically on stilts. So nowadays you kind of have a similar thing going on where, you know, pop culture stars and athletes are in these, you know, expensive footwear or footwear that everyone else desires to have. Along with that, you also have people in positions of power or authority creating the kind of models for the footwear. If we think back to King Henry VIII, he dealt with gout and swollen feet a lot, so he actually implemented a law that footwear had to be created at least 6 inches wide, right? So now everyone's in this really, really wide footwear solely because of the king. So you find these aspects all throughout history. They kind of happen time and time again. The saying goes, history repeats itself. It absolutely does. But now let's go to more recent history. In the early 1900s, we had footwear starting to be made for performance advantages. So we had track athletes going to the Olympics. These footwear companies started popping up and making shoes that had, you know, increased friction on the sole so people could stick to the track a little bit better. You know, and then they started to go through changes over the next couple decades, and in the 70s we had the big running boom, and that's when we really started to cushion up the shoes to prevent injuries, as we say. But really this was just in response to a bunch of novices or people who were new to running regularly going out and running too much too soon. So we created a shoe that was actually exaggerating the issue and causing more problems in the long run. So now we've continued to kind of roll down this hill as the snowball is just gaining more snow. It's created a situation where we just keep adding more stability, more cushion. So again, back to what I said earlier, we've fallen into this trap of creating shoes to actually protect us from ourselves rather than that outside environment. So now we're going to get into the footwear of today and kind of the characteristics that are part of, you know, the modern or conventional footwear. We got a Hoka shoe here. You know, it's a nice representation of what we have kind of in conventional footwear. It's not every shoe, but, you know, we see a lot of similarities between this shoe and some of the other ones. So I'll have Katie bring the camera up close. I'll just talk while Chad goes through the model here. So first thing we want to talk about is the toe box in the front, and you can see how it kind of gets really narrow, and then in the front it comes to a point. Our foot is meant to be widest from big toe to little toe, and that foot does not afford the opportunity for the foot to do that. Now you see the Vivobarefoot, how it has a nice wide toe box, and it's more of a straight line along where that big toe would be. That allows that foot to spread, it allows those toes to function the way they normally want to function, and it allows, you know, the foot to absorb shock really well. All right, next thing we have in the front of the shoe, you see what's called the toe spring here. So the front of that toe lifts off, and that's in large response to, you know, the companies. We know we have to push off through normal gait and running, and the companies have said, oh, well, let's assist the human body in pushing off. So now the shoe is assisting the push off with that spring. So the foot stops doing it because it's like, oh, well, I don't have to do that anymore. The shoe's taking care of it. Right, next let's talk about the stack height. So that's the height of the sole really. And the stack height on most shoes, but running shoes definitely, is higher at the heel than it is at the toes. So we get a significant heel to toe drop. So we'll talk about those kind of together. But you can see how this on the Hoka is very, very thick, right? So that's gonna be a lot of cushion. The foot's almost searching for the ground when it's in that shoe. Versus the Vivobarefoot, it's got a very, very flat stack height. So your foot is much closer to the ground and it can function more optimally. But that heel to toe drop is super important, and we'll go into that more when we talk about what's happening in the shoe, because now we've put the heel up from where the toes are, so we're creating a ramp that the foot is sitting on. So imagine being on a ramp, right? If I'm going down the ramp, I have to lean back a little bit. If I'm going up the ramp, I have to lean forward a little bit. So it really changes the way your whole body functions up the chain. All right, and then we'll talk about this flexibility of the sole. So you have these synthetic components that are now made as part of the shoe, and this sole does not manipulate very well, right? Versus you have a Vivobarefoot here that is very adaptable, right? your foot can do the molding to the ground. It can manipulate to whatever environment or terrain it's on, right? And then the last thing we'll talk about is this heel counter. So the heel counter is made kind of stiff back here on most shoes to like suction the heel in, so the shoe stays on better. But really what that does is it restricts movement of your heel, which is super important and often overlooked in a lot of foot issues, because it really triggers, if you think about walking, the heel hits first, so that triggers the cascade of events that should be happening. And if my heel is restricted, that cascade's likely not happening. So those are really the big aspects of the shoe, and we'll kind of briefly mention those again as we talk about what's happening inside the shoe.
All right, so let's kind of talk about that heel toe really quick. I know Nick went over it really fast, but for those of you that are familiar with the heel toe drop, if we're looking at the heel to toe drop from this angle here, you can see that Hannah is definitely at an angle, and this angle is actually a pretty good representation of what the normal heel to toe drop is in a shoe, and this is exactly what this looks like. Just imagine walking and running in that all day long and figuring out all of that stress and where that's being placed in the foot. So that kind of brings me to my next point, which is, what does this foot actually look like in the shoe? And what we're gonna do is we've actually, sorry Hoka, but we cut up one of your shoes. It's for educational purposes, you do understand. So we put Hannah in the shoe, and you can see as we kind of pull this up, you can see that, I mean, her big toe doesn't even really want to fit in there. Her little toe wants to fall off the edge. So you can kind of see as these toes get scrunched together, you know, how we're not getting that nice toe splay like we're supposed to, which also reduces our stability on the ground. Not to mention that as that sole comes down, you can see that this foot here is nice and flat, while this foot kind of comes down and then right back up again from this toe spring that we have in the shoe. All right, so that's one good example of what that foot looks like in the shoe. The second example I have is, and this is obviously exaggerated, but we got a nice Airex pad here, and we're gonna have Hannah stand on this Airex pad. And we have a saying here, and it's a hard foot in soft grounds. All right, so if the ground is soft, that means the foot is hard, meaning it's rigid, okay? And it has to be rigid because now your body's really fighting all these forces from the comfort of the shoe or from the instability of the shoe. It's almost like you're walking on an Airex pad all day. Obviously, it's exaggerated. But you can see that if we have Hannah stand on one leg here for me, good, you can see instability, right? Now, let's stand off the pad there for me. And then I'm just gonna have you just take a little hop on that pad. Yep, so what happens? Boom, that foot goes right to the outside. Why? Because she's trying to create stability. We've got no load, we can't feel the ground, okay? So now we take this away, all right? And we're gonna have Hannah just stand right here for me. And now Hannah's gonna stand on one leg again, all right? Now we've got some movement here, but you can see she's not moving towards the outside as much as she was before. Now we're gonna have Hannah just take a little hop there again for me, just like you did before, good. And then now we've got this nice load into the ground, okay? The load into the ground is what we like to see, all right? And that's how the body loads itself. So this would be considered a hard ground equals a soft foot, okay? Soft foot means the foot is flexible, okay? The foot is adaptable. It can adapt to change. It can also adapt to the environment that we're standing on, all right? We always want to be in contact with the ground. When we have a stack height like this, all it's gonna do is just create instability, and now our muscles are just working super, super hard. Not to mention, we're not getting that nice load into that foot like we're supposed to, which is gonna affect her all the way up the chain, okay? So kind of going on to that, if we have Hannah step right on this pad again, okay? I'm gonna have you just step with this foot. Just step this foot back for me. So if we have Hannah in a balanced position just like this, yep, and she's always going to be pushing her foot to the outside. You know, you can actually have your foot behind you. Yep, that's perfect. All right, so what's gonna happen is if we can't get this nice load here, okay, and we're stuck on the outside, we're not getting this nice, what we call tibial internal rotation load, okay? That basically means that this loads in, okay? Your tibia is this bone above the ankle. It's gonna load in, all right, which helps load the knee, which helps load the hip, which helps load the whole kinetic chain. Okay? If we're not getting that because we're stuck here, guess what happens? Now we have excess stress on the knee, we have excess stress on the hip, and now we have back pain. It's weird, but it all happens from the ground up, okay? When that foot hits the ground, everything changes up the chain. So if we're not affecting or if we're not changing what happens at the level of the ground, then we can't affect what happens up the chain at the same time. So if we take this out and we have Hannah in the same position, all right, as she loads in, we get this nice, what we call midfoot pronation, okay, which creates this nice tibial internal rotation load, which then loads the knee, which then loads the hip, which then loads the back, okay? Obviously this is exaggerated, but it happens like that, okay? So it's like what we call a load to explode. If we're not loading and we can't explode, then number one, we're predisposing ourselves to injury, but we're also decreasing we're leaving a lot on the table when it comes to performance training, okay? So that's chain reaction.
We can look at that too from a postural perspective. So if we take Hannah again, go ahead and stand right there, Hannah.
Yep.
All right. So you can even see, now we know posture, right, is not associated with pain really at all. But if you take these changes that Chad was just describing and just look at static stance, right? See how she's on this elevated heel, right? The knees are slightly bent, but then if I tell Hannah, go ahead and stand up tall, right? You can see how she immediately arches the back, pelvis dumps forward, right? So those things are going to manifest themselves as she moves. If she's in those shoes all the time, 8-hour workday, then even afterwards, those are going to manifest themselves more and more the more time you spend in the shoe, right? So you think about the knees jutting forward, there's a ton of pressure on the anterior knee. Okay, well, a ton of people deal with pain in the front of their knee, right? That's a super common thing. How about now the pelvis dumps forward, shortening up those hip flexors? Well, a lot of people complain of tight hip flexors, and then the back excessively arches, right, which tightens those back muscles. Oh, a ton of people deal with back pain, right? Nearly everybody. So you can see how this can manifest itself up the chain. We can even take that higher, right? So now as her rib cage flares open, she's stuck in a state of inhalation, right? So she can't exhale as well. So she's over inhaling. And when we think about inhalation, we get an increased response of your sympathetic nervous system or your fight or flight, and you get your parasympathetic or your rest and digest as you exhale. If she's limited in exhalation, she's stuck in that fight or flight state, right? So her sympathetic response is overactive, and in today's day and age where sympathetic tone is heightened anyway from technology, lights, noises, work stresses, life stresses, all those things, now we pile that on with the mechanics of from the ground up just being in a different shoe. It really exaggerates not just orthopedic issues or biomechanics of the body, but it can exaggerate other conditions, whether it's digestive, endocrine, anything like that, respiratory. So you can see how just from the ground we can get ripple effects, and obviously it's exaggerated like we said before, but it plays a role, and it's not the only factor, but it's a factor that we can absolutely control, right? We're putting the shoe on our foot every day. If we can be in something that lets our body operate the way it was made to operate and the way it wants to operate, we might be doing all the systems of the body a huge favor, all right? So in talking about this kind of stuff, we like to use the example of nutrition. So you could think of it as, say you eat junk food a little too much, right? Then you start craving junk food more and more. And then you give in to your cravings, and then you're craving it more and more. Same idea can be thought of with these, overly cushioned and, max support or max stability shoes. The more you wear it, the more your body craves it. Now, could you eat, all these processed foods and excessive sugar on a daily basis even and get away with it? Yeah, some people can get away with it their whole life. Some people 5 years, some people 10 years. But at some point, we've seen over and over in the research that that type of activity is related to numerous conditions, right? And we're starting to see some of this research trickle in about the footwear and how it's, these excessive bunions being diagnosed, callus formation, corns, plantar fasciitis, increase in Achilles tendinitis, and rupture in pretty much all professional sports. These are huge, huge implications as to what's going on and why is this happening? And we think footwear plays a huge role. So back to that nutrition example, if you start to wean yourself off of sugar processed foods, right? You get the cravings pretty intensely early on, but the less you eat it, and the longer you go, the less those cravings are there. So we use that as a good example to explain to people, you know, why your foot's craving this type of shoe, but as we start to wean you out of it, you know, do some more barefoot exercises and some regular barefoot movement, your body starts to actually crave the opposite, and it doesn't get those, you know, cushion cravings quite as frequently, and at some point they'll start to dissipate completely, you know, and at that point we've gotten you in a more functional shoe that lets your body operate the way it was made to operate. So in saying that, we can get into kind of our approach as physical therapists and strength coaches with regard to this transition of going towards a shoe.
A lot of people had questions so far about the transition.
Yeah.
A lot of good ones. And that's obviously a hot point. It's like, all right, what do I do now? Now I know all this information. How do I make the jump, right? And it's a gradual change, okay? Everybody that comes into our clinic, if we're trying to kind of push them in this direction, we don't just say, here, put these on. That's going to be good. No, it's a little bit more complex than that. Byrne, I think you mentioned ultras, and we're big ultra fans. And that's in the transitionary phase. Ultra is one of those shoes that has still got that stack height, but it's a zero drop shoe all the way across. And that's usually where we'll start to transition people, kind of get them out of this heel toe drop, you know, coupled with all the exercises that we're giving them, and then make that gradual change with stack heights down towards where we can get them more to a normal natural footwear.
And the Ultra's huge too because it's got the wide toe box.
Yeah.
So Ultra's doing it right with that. That toe box, letting the forefoot splay, the toes splay and spread, so your foot can absorb shock. And we do like the Ultra more so as a transition shoe, but there are some people that actually Ultras are very much indicated for the ankle. You know, people who have either had a pretty substantial injury history might be better off in an Ultra. They might not get to a barefoot or a minimalist shoe. Someone who is a little bit older and, you know, their feet are a little more atrophied, and it would take a lot of time and you know, almost excessive effort to get them into something more minimalist. We're okay with them, you know, being an Ultra outside the house and then try to be barefoot at home. That's totally fine. We got to meet in the middle. It's a big spectrum, you know, and there's better footwear over here and there's worse footwear over there, and we want to be somewhere close to in between middle and more towards better footwear and try to get away from that other side. You know, you don't necessarily have to be all the way at one extreme, but we don't want you at the other extreme either, or closer to that extreme. We want you closer to the better footwear extreme.
Yep, yeah. I mean, and what we'll usually do with patients is it's like, you know, we don't just say, here, go buy this shoe. You know, it's more to it than that. I mean, I just had a patient come in today. I kid you not, this is crazy. He came in, he's got the flattest feet ever, which we already know. Most people are going to be like, well, I got flat feet. My doctor told me I have to wear orthotics or I can never walk barefoot again. I mean, how many times have you been told that? We hear it every single day. It's not a surprise anymore. But he comes in, the most max comfort shoe you could ever buy. It almost looked like somebody, what's like
it would look like a moon boot.
Yeah, it's like a moon boot with a huge orthotic in it. And then they said, okay, that's not enough. Here's a lace-up ankle brace. I was like, man, we might as well just put you in an AFO and call it good. So my response to him was,
just give you a new one.
Yeah, and my response to him was like, hey man, we could go about this two different ways. You could either work with me, we can kind of get you out of all of that, or if you're totally comfortable wearing this brace and this orthotic and this shoe for the rest of your life, then we're done. You know what I mean? So obviously he chose the first choice. So we're working with him slowly, but what do I do with a guy like that? You know, and the big thing is, it's like you don't want to make any drastic changes right off the bat. Real easy is like, hey man, why don't you spend a little bit more time home barefoot, walk around the house, because most people will be like, oh no, the second I wake up, I put my shoes on. It's like, well, maybe we need to get out of that habit and just slowly transition you out of that shoe. Use your feet at home, you know, in the comfort of your own home, and then let's gradually get you into that point where you could use a more of a comfortable shoe, you know, kind of like those Ultras. You know, and then work down.
And you could use, you know, numerous examples for this, but I mean, let's talk about a runner, for example. So on the market now, conventional running shoes, or they're labeled as running shoes, because realistically, you could run in anything. But what are labeled running shoes? The average heel to toe drop is about 10 millimeters. So you're talking right around 1/4 of an inch, pretty substantial. Some are better than others, but if someone's been running in that for a long time, I will never say, okay, let's just get you in the barefoot shoe, or let's get you in a zero drop shoe, I progress them typically to something with a little less. So we'll actually sit together and you know, scan the websites of all the different shoe companies and look at the specs and say, okay, your shoe right now is 12 millimeters drop. I want to get you to right around 6, and then I want to get you to 0 drop from that, and then we're going to worry about the other components. So we kind of attack it component by component, right? Or say we have someone else, for example, right now I have someone that has extremely narrow feet and has been dealing with recurring stress fractures. And my big thing right now isn't even the drop, it's the toe box. I want to get something with a wide toe box because I want her foot to spread and give those toes room, because we actually saw a recent study a couple months ago that they just literally took a finger, pushed the big toe inward towards the other toes, and it restricted blood flow by almost 25%. So if that's happening over and over, you can imagine how those stress fractures are going to have a hard time, you know, healing if they're getting 25% less blood flow. And then that's probably even more if you add, now I'm running on top of that, right? I'm probably restricting blood flow even more. So it depends on the individual. It's very individualized, but we'll typically attack one of those factors first, whether it's heel, toe, drop, toe box. Those are pretty much our 2 favorite to hit first. But it depends on the individual, depends how they present, depends where their symptoms are, you know, and what they're describing. And everyone's going to progress through those processes a little bit differently. Some people just, you know, they adapt a little quicker. So they might progress, you know, a mile per week walking or running. Some people might progress a mile every couple of days in those new shoes. But typically what we'll say is, okay, let's get this new shoe. This is the goal to get here. What we're going to do, so say you run just ballpark 20 miles a week. All right, we're going to do just 1 mile on each of those run days. So say it's 4, it comes out to 4 miles, they have 4 running days. 4 miles to start in that new shoe, then the other 16 are in the old shoe, right? And then we build that up. Now we double it. 4, then it's 8 and 12, okay? Then it's 12 and 8. So we kind of build up that way, slow progression. Slower is usually better, and if someone's responding really well, then we'll increase the speed a little bit.
Great, yeah. I know a lot of people have questions on, you know, what the sizing with the Vivobarefoots. From my experience, because I've got like a million of them, is that they're pretty true to size. I take a size 14 and I wear a size 14, so, and it works perfectly. I tend to like the lights; those are my favorite ones, but they're all great. But in terms of sizing, they're pretty true to size. Other than that,
I will say on that most people, the research has shown us that most people are actually wearing shoes that are too small for their foot. So if you have typically gotten a, you know, 12, maybe you want to try a 12 and a half or a 13. You know, the Vivobarefoot is going to feel, when you first get it, if you've never had it before or had a shoe like that before, it's going to feel bigger as a result of just being wider than other shoes, just naturally. So you have to let your body get accustomed to it, you know, and get used to that increased width, because it'll start to use that width more the more you move around in it. The other thing on top of that with the width and everything is that, what was I going to say? I don't remember. I was going to say something.
Oh, anyway, yeah, these are the lights. I know some people are asking what shoes am I wearing. So these are my lights. These are actually the stealths. They both feel very similar. I will say that there is a different feel with the recycled versus the non-recycled. The recycled feel is it's kind of a little bit more on like the I don't know, how would you describe it? Like,
it's a little stiffer.
Yeah, it's stiffer, but it's not like restricting stiffer, you know? Exactly. Just the material is a little bit different, but they're both super comfortable. But just know that the one thing that you'll get is people saying, oh well, if I wear these things, I'm probably going to get Achilles tendinitis, or I'm probably going to get plantar fasciitis, because I've already seen that a few times. So I know people are asking about that, and the answer that I'm going to give to you is that if we're always stabilizing our feet with supportive shoes, then you're always going to have plantar fasciitis, because every time you take the shoe off, you're always going to be weak. All right, if you're not using those muscles in the foot on a daily, then you're always going to be weak, and you're never going to adapt that tissue to change. You're never going to adapt that tissue to low tolerance. It's just never going to happen. So every time you are prescribed a boot from your doctor,
and your doctor's like, yep, take a week or 6 weeks off or whatever, and then you take the boot off and you're like, well, I felt great when I was in the boot, now I have pain. Well, that's why, all right? Because now you're increasing the stress on that tissue that hasn't had any activity whatsoever. So if you're not going to adapt that tissue to change, then it's never going to change itself.
So, and on top of that, the human foot has over 200,000 nerve endings in it, so it's craving sensory input. So when you get in a shoe like that, you're going to get more sensory input. But if the foot has been operating in a different shoe, which was not a sensory-rich environment as this type of shoe, it could be a little bit of overload. So that's why we want you to go slow, because from the sensory standpoint, you may develop aches and pains here and there because the nerves are being overloaded when they weren't before. So you have to, it's just like anything else, progressive overload, graded exposure. You wouldn't go to the gym, having never benched before and just load the bar up at 225. You have to progressively overload that movement and make sure your technique and your mechanics are on point, and then build on top of that. So, any other questions you got there?
Yeah, so somebody brought up the toe spacers.
Okay.
So toe spacers is great.
Yeah.
Toe spacers
Absolutely.
is definitely one of those transitionary things that we do as
Yep.
well. There's a company out there called Correct Toes that we use. There's also one put out by the Foot Collective. They
Yeah,
make
they
their
have
own
Wild
as well.
Toes.
Wild Toes. And they're literally like silicone spacers that you put in between your toes, and it creates that toe splay. And what we'll usually tell patients to do with that is, and even if they don't want to buy it, what I'll usually do is I'll just say, hey, take a sock and then just wrap it in between the toes. Give yourself some space in between those toes.
You could even do it with your fingers.
You could even do it
right?
with your fingers.
You could create that space.
Yep.
But the toe spacers are nice because you can spend some time in it. And the key with toe spacers, so it's great if you just wear them, you're sitting legs up on the couch, that kind of stuff, but we want to maximize function, right? So we want the foot to spread as we move and land our foot on the ground. So the toe spacers are best paired with movement. So I would recommend, more so than just hanging out in them, spending some time moving around the house barefoot and build up that time. Same idea with the graded exposure, right? Start with 5 minutes of just some light movement, and whatever's comfortable to you. Go for a walk, or just move around, yoga, something like that. Some kind of activity where you're moving in and out of a variety of positions is good, because you're making the foot spread and splay a little bit more, which is more natural for it, but again, it's going to be new because the foot hasn't done that in a while.
Yep. There was another question. It was, do the ecos make your feet sweat more? I haven't noticed the difference. Maybe you do because you sweat more, but I don't notice the difference. They actually breathe pretty well because there's a mesh on the top. And then another question was the clarification of the transition at home. Being barefoot at home inside of the home, the answer is yes.
Yes.
And then, transition to your shoes outside. Yes.
Spend, find your time limit, when your feet start to bother you, okay, that's your time limit, and then build on top of that, and expose your feet to a variety of surfaces and terrains within the house to start. So not just the hardwoods, rugs, different types of rugs, find even just some other kind of surfaces, whether it's something like in your yard, right in the backyard, grass, things like that are great, because your foot is again craving that stimulation, that sensory stimulation, and if you're giving it the same stimulus over and over, it will get really, really good at responding to that stimulus, but it won't have the wherewithal when you put it in a situation where, okay, maybe it's on gravel, or maybe it's on blacktop now. So if you expose it to a variety of terrains, you'll probably be able to transition a little bit quicker than the person next to you. Yeah.
Cool.
All right. So to summarize, really, we really firmly believe that footwear has created big implications and big movement issues for our feet. And in a world where we're moving less already, if we compound that with footwear that makes our body move differently, we are really exaggerating the issue. And yes, we need footwear and shoes. They're very much a necessity nowadays for protection from, the elements, cold, especially depending on where you live, man-made sharp objects that could be on the ground, or even man-made terrains, street, sidewalk, things like that. But the reality of it is that we have a skewed representation in society of our feet as being fragile and weak, but that's not the case. Your feet are extremely adaptable and resilient, and they are much more adaptable than anything we can manufacture.
Great. Well, thank you for tuning in, and hopefully we'll do it again with you guys sometime.